Everyone, Dr. Ryan Wakeham here. Thanks for joining us again for another episode of Mental State, a podcast about innovative and progressive treatment options in the field of behavioral health. Today, I'm very pleased to welcome a very special guest, emotionally and otherwise for me, Dr. Jon LaPlante. Dr. LaPlante actually comes to me as a former patient of mine, and someone who has experience in the use of the drug we're going to talk about today, specifically ketamine. So first off, I wanted to, again, thank you for coming up. I know the trip hasn't been too short for you and on many different levels. So first off, I want to just, again, thank you and open it up to say, again, you have experience with this, but maybe give the audience a little bit of a background of kind of who you are and what you do and where you came from, kind of thing.
Sure. Well, thank you for having me. I've looked forward to coming up and speaking about this. My name's Jon LaPlante. I am a recently retired physician in radiology, and the sequence of events that led me here and caused my retirement were related to my daughter, who became acutely ill, and subsequently died. And a few months later, my wife, we'd been married for 22 years. We both struggled with the episode of Claire dying, and it was a very traumatic, emotionally traumatic event for 3 months for us. And then after that, my wife struggled tremendously with it. She would not seek professional help. And in the end, she took her own life in about the middle of June. And that was really traumatic for me because those two women were the center of my life. They were all I had. They were my only family, and they were both gone. Thankfully, I'd been in touch with you several months prior, helping me with my depression and anxiety related to my daughter's death. And that's where I came across you. And after my wife died, I got extra help from you in related to ketamine. And it really transformed my life. It saved me.
Yeah, it strikes a nerve for me too, because again, I still recall our first visit. I think it was a friend of yours. I called the office and was just looking for anyone who could help. And, I squeezed you in my schedule and just heard the story about your daughter. And that was, traumatic for me too. It's just a terrible event. And then through subsequent visits, we even talked about your wife and how she was doing. And you were seeing, or still see, I think, one of our therapists. And I know that was a struggle for you on a lot of levels. And then when I got the news about what had happened with your wife, again, we got you right in. And it was at that point, as a provider in the space of mental health, I think I even said this to you on that call, on that video call. I totally understand where you are right now, right? Not that I've experienced it, but I totally understand your thought process, right? Because you were very candid with me that, you weren't sure you were going to make it another couple of days. And as I told you on that call, if I'm remembering correctly, I'm not here to convince you otherwise. I understand. So, all the visits kind of leading up to, and I just remember that call, or, that video visit that day where, as I said, although I've not experienced what you've experienced, I totally understand where your mindset was. And I remember thinking to myself, what do I do, with this situation? A physician, a colleague of mine, in this position where he seemingly lost everything very quickly. The purpose of your career, your daughter, your wife. And like I said, I wasn't there to change your mind. But I do remember thinking at that time that, we did have the option for something called ketamine, in terms of something that's rapid acting, has actually been studied, although off-label, in suicidal thoughts, I just remember saying to you, like, it's not about the money. Just please come in. I think this was a Thursday. And I, said, I will get someone here tomorrow to do an infusion with you. Please come in rather than doing whatever it is your plan is, right? Just kind of give us the opportunity to try to help you. And then I'll throw it back to you because, then you came.
I did. I listened to you and your suggestion of using ketamine, a drug I had not heard of before being used for any psychiatric purposes, but I was in such a raw emotional state that the pain was so intense, the regret, everything I was experiencing was overwhelming, and at that point I just really didn't care personally what happened. My sister was there with me, and after hearing you on the phone describe this, I said, I need to do something. If I'm going to do anything, this is it. And after we hung up, she encouraged me, I was going. There was no other option for her. She goes, you're going. And she brought me in, just as you said. And it was a very simple procedure. I didn't have any trouble with the procedure. The CRNA that took care of me and put me in the room, put me in a very quiet room, spoke to me in depth about the procedure and what I might experience, some side effects that may or may not occur. And she gave me the drug. It took, I can't recall, maybe 45 minutes, seems about right. And it was a very interesting experience, never ever having taken ketamine or a drug similar to it. I was in for an experience with the drug. Okay. It really was, but it was a very interesting experience. If you want me to elaborate on that.
Yeah, I think the more we can help explain to others kind of what it's like.
Sure.
As being a physician yourself and someone who's been in that position, I think that's really important.
It is. She laid me down in a very comfortable chair that I could recline in, and she sat across the room from me, and she inserted an IV in my arm, a blood pressure cuff on me. And like I said earlier, she described in detail what was going to happen. She gave me an IV medication for potential nausea before the procedure started. And then she started slowly infusing the ketamine in. I felt no discomfort or pain related to it. As a few minutes would wear on after she started the infusion, just became a little more relaxed, a little bit sleepy, but just very relaxed and unhurried, and it was a comfortable place. It was actually very comforting to feel that way. And then as several more minutes went by, I began to drift off and relaxed even further, got more sleepy. And then the experience is really interesting. You slowly, in my experience, you slowly become almost dissociated from your body. The body seems, your weight of your arms and your legs kind of disappears, and you enter this very peaceful, quiet place where there's no fear, there's no anxiety, there's no pain. And it's hard to explain in detail, but I remember the experience very well. Over several minutes, it was hard to generate a feeling of time, but you would drift through this almost weightless space. And at the same time, you couldn't see any visual items. You didn't hear anything. You didn't see any persons or images or anything like that. what I saw was just very slight changes in this kaleidoscope of color, very muted colors, whether it be a slight yellow or a blue or a purple. And the motion of the whole event would slowly change in front of you as you would lay there. And you would move from one color scheme or one event to another. And it's very quiet, almost kind of floating kind of experience where you would move from almost scene to scene. And the thing that I remember the most, other than that, was the deep connection that I could feel. I could feel myself searching and looking at this subconscious level for my daughter and my wife. I could actually feel the love and the presence of them there. It was just an amazing experience. I couldn't see them, but I was looking for them in my mind. Not in an anxious way, but in a very controlled, kind of anxiety-free way of searching for them. And that's how my mind went through this experience with ketamine. It was a strange kind of experience, but again, I just would like people to know that there's no fear, there's no pain, there's no worry about this trip. It's very comforting. It's one of the most peaceful things that has happened to me in a long time. But I can still recall in each of the ketamine experiences that I had, the feeling of being close to someone that you loved. It's where my mind went during that episode of ketamine. Truly a remarkable experience. But afterwards, and as soon as the drug would wear off, and you were still laying in it, you would feel the weight of your body return. You could feel your legs and your arms, the presence of them, and you became slowly aware of the surroundings of the room would come back to you. And then you would hear, small noises would become apparent to you again, and the CRNA would say, are you okay? How are you feeling? And you were back. But I will comment on one thing that I thought was really interesting. When I would return to the room, to the present, to me it was a very strange experience because I feel like I couldn't actually speak English. I didn't feel like I was returning to the right place. And it took a while for the mind to recapture the feeling of the present, of where you were. It was odd that you came back and you realized you would speak, but I wasn't sure the words I was using were correct. And it took several minutes for that to come back. And I realized, okay, I've returned to the room. And I would be a little bit groggy for a few minutes. And she would continue to monitor me and my blood pressure and my heart rate. And after about 15 minutes, I felt reasonable enough that I could stand up and move around. A little unsteady, but I had no headache, no discomfort of any kind after finishing it. And then I'd always had someone there with me that could drive me home. Because it's just not safe to drive after having this. But that was kind of my experience with the drug. It was very interesting. And the effect for me was within an hour or so of the intervention with the drug, I felt better. I felt like someone had flipped a light switch on for me. Was in this very dark, very emotionally serious position to be in, with my suicidal thoughts and the depression that I had. And it felt like a weight had been lifted off of me. Emotionally, physically, I just felt better. And I felt like I was more in tune with myself and other people, and I left a really dark place in a hurry with the drug. And the effects just continue to improve over the next several days, the next week. It was a tremendously dramatic experience for me, and the improvement I had. So I give it high marks. It saved my life.
Yeah, I think that's the most critical thing, right? Is we kind of entered into that Friday not really knowing what we had left. And we left that Friday knowing we were, at least had some time to work with something. And thank you. Number one, Jon, thank you for being so out there, right? It's not easy to talk about that stuff. It's not easy to tell that story, I'm sure. And thank you for explaining the experience, right? Because that's the unknown, the fear of the unknown, even for someone who's in that dark place. Sometimes the fear of what this is going to be like will stop someone from coming to get that kind of help. It's also interesting, as someone who's prescribed and overseen ketamine treatments for years now, it hits, your description of it is exactly what we talk about in terms of consent. Sedation as being a risk, not a risk of death, but just, you can get a little groggy or sedated. Sure. That separation piece is not uncommon to ketamine, so that people feel that floaty, or the loss of the weight of the arms and legs is a common experience. The mind struggling to catch up when you first kind of come out of it is really common. Other, like nausea, you mentioned being pre-treated with something to prevent, vomiting or nausea, which is another pretty common thing. And then to your point, it definitely leaves you in a state where you're not safe to drive, right? So one of the key things about what it is we have to coordinate when we talk about giving someone ketamine infusions is simply that they can't just get up and leave. They can't drive. They have to have someone to take them home and be able to rest from there. Along those lines, explain to me what the next couple of days or weeks were like for you.
Sure. It was an immediate effect for me. My sister, who drove me home, of course, and it took me to the ketamine treatment, noted the next day, she goes, the change in your appearance, your mental state, she goes, was immediate. She goes, it was just dramatic, the change that you underwent. And over the next several days, she was good feedback for me, because it's hard to know what effect it really had on you. You feel better. The tasks that I would try and do from day to day were easier to undertake. This feeling of dread and loneliness and guilt that just overwhelms you for weeks and months, to the point where you'll do anything to stop the pain, anything. It really abated. It really turned it down quite a bit. I had been on antidepressants ever since I first met you, and you were prescribed those for me, and I did get some relief from that. But after my wife died, it was just overwhelming for any oral medication that you might take. This changed all that. And as I went forward, there was a prescribed series of doses that given my critical state of thinking and where I was mentally, I went back about every 3 days, maybe about twice in a week. I would go back and I would get another infusion, and I'd go through the same experience. Again, no side effects for me. Slightly different experience each time. And I would say by the time I received my second and certainly my third dose, my whole mental state had dramatically improved. There was no doubt about it. The serious depressive effects that I felt, the suicidal thoughts that I had, were simply gone. Occasionally I would get lingering events and recall my wife or my daughter, and it would make me, pretty mentally challenged at trying to overcome them. But overall, the change was dramatic. And I went through an entire episode of 6 ketamine infusions over about 3 weeks. And I could almost feel like I could say I was human again. I felt, almost immediately I felt human again, but that light switch stayed on for me. I was a much brighter person. I wasn't near as snappy or edgy with people. I really felt a renewed sense of purpose that, I can survive this. So it became clear to me that it was no fluke with just timing or an event. It was a lasting effect. And it lasted me, more than 4 months now. And I would certainly recommend it to someone that was in a situation similar to mine, or it's certainly a drug that truly has benefits. And given a bad situation again, I wouldn't hesitate to take it again if I had to, only because its benefits are just tremendous.
Thank you for better explaining kind of what the next couple of weeks look like for you. So I want to take the time to explain to the audience kind of what the standard prescription for ketamine is. Generally speaking, when we're to the point of doing a ketamine infusion, we generally, the studies tend to show getting around 6 infusions in within a 3-week period. So sometimes that's 3 times a week for 2 weeks. Sometimes that's twice a week for 3 weeks, but just trying to get a total of 6 infusions in that first 21-day period. And that's exactly what we did with you. And then to your point, the success rates with that can get very high, especially in individuals who are at that level of darkness or that level of treatment resistance, is really where ketamine tends to fit in. Whether that's just that dark or safety concern level, suicidal ideation, or just have run the gamut of medications and can't seem to find relief after 2, 3, 5, 10 medications. That tends to be the ideal patient for ketamine. And then again, tends to be about 6 infusions. It has about a 65-70% success rate in that setting. And then does tend to last, can last standalone on its own upwards of 3 months after that initial series. Some people less, some people more, but generally 90 days is that initial period. And then I'll let you speak to a little bit more, but there does tend to be a backslide after that. It really is a long-term Band-Aid, so to speak. Doesn't tend to be able to be used as kind of a one-time deal and never again. So again, we do often end up in some sort of scheduled booster infusion, which again could be every month, every 2 months, every 3. It's unique to the person and the experience. So I'll let you kind of speak to that, because you mentioned after 4 months, maybe there was a little bit of a backslide, and I think you've recently had another infusion. So maybe explain a little bit around that.
Sure, that's exactly what happened with me. After a little more than 3 months, even though I was still on antidepressive oral medication, there was certainly a slow change that was creeping back into my mental state. I was a little more depressed. I had, again, some of these suicidal thoughts, although they were nothing like they were the first event I had. They would creep back in with my dark moments, and my dark moments during the day or at night, when they would wake me up, became a little more frequent and a little more intense. I thought initially it was just, related to events around my life. I've been busy doing lots of different things. And so I didn't really pay a lot of attention to it, but the symptoms progressed for me slowly. And by the end of my 4th month, I realized I was in a bad spot. And I contacted your office, and initially there wasn't an immediate availability for IV ketamine, so I was given an alternate ketamine dose. And they gave it to me intranasally as an emergent kind of Band-Aid, as you mentioned, fix. And then they had me scheduled the next week to get me into IV ketamine. That, of course, was the first time I had intranasal ketamine given to me. And the effect was similar. You know, they put you in a quiet room, and it's a much simpler procedure. And they give an injection into each nasal passageway, and then you just basically sit back and lay down and relax in a big easy chair again. And the trip was similar, but more muted. It wasn't as an intense of being asleep or weightlessness that you feel the first time. And after about 30 to 40 minutes, I believe, the dosing was over. And the same thing, you have to be careful and rest for a few minutes after it, and then have someone drive you home. I had my follow-up IV ketamine just yesterday, and this was scheduled today, but you know, and my experience with the IV ketamine, even after 4 months, was very similar to my first events. Nothing really changed. It was still a very relaxing, pain-free experience that, again, interesting for me, it made me feel closer to my daughter and my wife in a very strange way, that I could feel their, you know, presence near me, even on my trip. But the same kaleidoscope of colors, everything was about the same. And again, for me, the effect was almost immediate. Even after the intranasal, which helped me, the help I received after the IV was even more pronounced. I could feel it even last night. The absence of those dark feelings and that dark mood that you're in was almost dramatically improved. And even today, just 24 hours later, the effect is even more pronounced for me. It's brought me back to very close to where I was 4 months ago with my treatment. So maybe it's described as a booster, but for me, it was excellent timing, and brought me back around again.
I think that's, well, first of all, that's great, right? Ideally,
yeah, for sure.
Being able to maintain this benefit is obviously critical. But you do point out a really good point, which is ketamine, although the most potent or maybe effective version is IV, which is a little bit of a procedure, a little bit more time, a little bit more intense and lengthy. There are other options, right? So we do ketamine under the tongue. We can do ketamine intranasally or in your nose. And although they may not be as effective, they can absolutely serve for some individuals who aren't quite where you were. They might rein things in and be able to help in a very short amount of time. Which is a critical part of ketamine's function, right? Where a traditional antidepressant like a Celexa or a Prozac could take 4, 6, 8 weeks, to really make a change.
Sure. And
when you're in the position you were in, you can't wait 8 weeks to get a benefit.
Absolutely.
So ketamine really, I really found a place for it in my practice because of situations like yours. People who needed help now, not 8 weeks from now, right? And that doesn't mean you can't be on ketamine or use ketamine with an antidepressant, which is another key point. You've mentioned it a few times now. We often use it in combination as a way to kind of bridge a gap or rein things in and get them controlled sooner while the medication takes control. So again, thank you for pointing that out, because it is important for patients to know it's not only IV or nothing else. And it's not only IV or no other medication. There's different routes. You can use it in combination with other things. That's most commonly how we use it. I also want to say, Jon, I mentioned at the very beginning of this that you're a former patient of mine, and I think it's important that the audience understands why. After your initial round of infusions, when I saw you on that Thursday, I wasn't sure you'd be there on Friday.
Correct.
you had reached out to me personally to say, again, you thank me for what we did, and the pleasure's all mine because I'm in this field and in this career for stories like this, right? But then you said, rather than being another number, you were going to make a change. So I think that's a good segue into kind of what you chose, or where the path has led you to this point.
It is, and I've thanked you before, but I need to thank you again because it was you and your practice and the people that you have working for you and the drug ketamine together saved my life. There's just no question about it. I was in such a dark place that being in such a place like that, you'll do anything to end the pain. I truly understand, being a suicide patient survivor, the pain and anguish people were under. And but thanks to your intervention in the drug, I'm here today because of it. And as a result of that, it was suggested to me that I needed a new path in life, that with my family gone, the fact that I had retired, it became really important for me to have a second career, so to speak. Initially, the first thing that came to mind at the suggestion of a colleague of mine was to start a nonprofit. And the nonprofit, I've given it the name, the Elizabeth and Claire LaPlante Foundation. And I asked several people to support me and help me in this project. And this started about 5 months ago. And as of today, we have come a long way in getting the IRS information we needed, the groundwork, the objectives that we would really like to cover. But for me, the nonprofit is going to be about 2 items. First of which is suicide prevention. I really, in my time left on this planet, I would really like to see an improvement in the outcomes of suicidal patients, the acutely suicidal patient. And with your help and your practice, I want to expand the knowledge, the availability, and the pathways to understand ketamine, to make it available to patients, clinicians who might not be aware of its uses and the effect it can have on patients. It's one of my primary goals. And a secondary goal is what eventually killed my daughter was a overwhelming adenoviral infection. And this is a particular virus, especially in the world of COVID that we live in today, that is known for a long time. It's known about its general effects and course of therapy, but in my daughter's situation, it was an overwhelming sepsis of adenovirus that destroyed her lungs, multi-organ failure, and after several months in the ICU and ECMO therapy, she could not be saved. And as a result, she died. And then subsequently, the effects of that caused my wife to eventually take her life. So it's a two-pronged approach. I really hope to make some serious strides in the years to come in suicide prevention, the expansion of ketamine and other drugs in major depression and suicide. But I really want to educate the entire medical system, primary care providers, even other psychiatrists, everyone that can get involved, to let them know what the suicide event was like for me and how it needs to be improved. Those are my primary goals.
I share the same vision, right? We too have a nonprofit, and we've been working towards how we break down barriers to care, especially for some of these off-label or more unique treatment options that really do have a place in the practice of psychiatry. And you talked about this a little bit, but what's shocking to me and to you is how few providers know about this as an option on the front line, so primary care hospital providers, emergency room providers. But even more shocking to me is there's a lot of individuals in the behavioral health space and psychiatrists and therapists and prescribers that don't know about it. And if they know about it, they also don't know what to do about it. It's that fear of the unknown and how you implement it. And, it comes with its own set of barriers in and of itself. So educating the general public, but also educating healthcare providers in behavioral health and otherwise on what the possibilities are. And I think we share that vision.
We do.
And I think that's part of the reason why you asked me to help with your nonprofit, which is why we decided that I couldn't be your provider and sit on the board.
Sure.
But we would find you an appropriate provider, be able to keep doing the ketamine as we needed to, but then really partner together, not as a patient-provider relationship, but more as a partner in how we expand access to these kinds of treatments and awareness to your kinds of situations.
Exactly. It's much appreciated. I hope for improved outcomes, new pathways, and getting the message out. I think that's the most important thing that I'm going to try and emphasize and working with you is getting the word out about these kinds of therapies and the benefit they can have for patients. I'm a perfect example of someone that survived a very harrowing mental situation. My time was short. I was on the brink of finding a way to end my life as quickly as possible. Because of your intervention and the use of ketamine, it totally transformed my life, and it's why I'm here today.
And that's why I'm so glad you are here today. Jon, the other thing, because I haven't seen you as a patient in a while, I just want to make it a point to say, I remember where you were when you were there. And it's really special to see you the way you are today.
Thank you.
With a new purpose, a new meaning, a revived spirit, and you just look so much lighter and so much healthier.
Thank you.
So again, a testament to the work you've put into it, because you showed up on Friday, right?
I did.
I gave you the tools. You had to build it, and that's really a testament to you. And I'm just so happy that that I've been blessed with having you in my life.
Thank you. Thank you very much.
When it comes to the foundation itself, do you have a website set up yet, or a phone number?
We do. We don't have an active phone number yet, but our website is very straightforward. It's LaPlanteFoundation.com. And when you access that, you'll see the website, which is now active. It'll list the board members, which include you and several other board members we have, our objectives, what our purpose is, and we hope to quickly grow into developing these improved pathways that I mentioned before and getting the word out to physicians, healthcare providers, everyone in the medical community, as well as expanding patient knowledge and the families that are involved with these patients to help bring them in and give a more complete understanding of what is out there for help. Because that really, if this information becomes more available to them, which I hope to inspire, it's the family member that can really step in and make a real difference and not be as fearful about making that call or making that commitment to seeking help, because it's an important tool. Without families and siblings and relatives involved in finding these patients and bringing them to healthcare providers, we're going to be in the same position we were before. So I really want to advocate their use, get them to lose that fear of intervening for their loved one, because it's what happened for me, and it's why I'm here today.
So I think part of what comes with awareness is when there's that fear, again, of Not almost fight or flight response. There's actually three responses. There's fight, flight, or freeze. And sometimes a family member doesn't want to commit to your point to saying, John's not well or John needs help because they don't know what resources they have.
Exactly.
And there's a freeze mechanism to that. They know it's not right, but they also know they don't know what to do. And when you don't know what to do, there can certainly be that freeze. And to your point, a lot of people fall through the cracks, not to blame anyone, but
No.
the reality is when the family system doesn't know how to help, it can be just as detrimental as if they do know how to help and have no desire to help.
Right. A lot of them, my family was no different. Even Elizabeth's family didn't know what to do, didn't want to make that extra step, that call to say, I know he's in a really bad place, but we're not sure what to do. We don't really know what tools are available to us, who to call, and thankfully, my family member or a friend of the family and you got involved quickly, and it saved me. But other families, other people aren't as, lucky as I was. So it's going to take some effort, but to empower the family and the family to get involved and take that step. I think they'll be more inclined to do it, knowing this kind of information and this kind of therapy is available. I think it'll really help people in the future, but it'll take some effort to get there.
Absolutely. And like I said, it's a shared vision, and we'll work every day towards it, right?
Terrific.
Jon, again, I really just super blessed to have you here and super thankful. Is there anything else you want to tell the audience, or anything else you want to say before we wrap up?
Well, I'll take a few minutes and just tell people that ketamine's real. The effects of ketamine are real. The procedure is nothing to fear. Having the drug is nothing to fear. I personally had a very good experience with it, both while having the drug and shortly after having the drug. I just want to encourage people to, maybe get online, read up about it, see what information they can find, talk to the local psychiatrist if they need to, and together people can really make a change in your life. I'm living proof of it. So that's what I would really encourage people is don't hesitate. Seek the information out. Seek out your healthcare provider, or in particular, a psychiatrist, and it's the real deal. It's a terrific drug, and in the right patient, its effects are profound. Thank you.
Absolutely, Jon. Thanks for coming. We'll provide some resources in the show notes as well. I want to thank everyone for taking the time to listen to this episode 5 of Mental State on Ketamine, and we look forward to talking to you soon.